Hello everybody, thank you for attending the webinar. Will chronic care management work for your practice? Our goal today is to help you learn more about chronic care management in order for you to make an informed decision about whether or not you should be adding this service to your practice. Before we get started, I'm going to briefly share with you a little about myself and about DrCatalyst, and then we will jump right in. I'm Harshil Shah, President of DrCatalyst, and DrCatalyst is a remote staffing solution company providing services designated to your office operation and empower you to do more. We work with over 200 doctors and we work with over 100 practices to provide them remote staffing services related to administrative services, a lot of billing services, for an example, authorization, referral, remote phone assistance. We also help in IPA services. We also do chronic care management services. We help them do marketing services and much more. At DrCatalyst, our vision is to have all the patients in United States receive high quality care from all US health facilities. And our mission is to provide high quality services to our clients so that they can better deliver patient care and ultimately improve the lives of the patient. That's our goal. We'll go over some of the webinar audio control related option. So first of all, before we get started, I wanted to take care of couple of housekeeping issues up front. First, everybody is muted and we do that for a couple of reasons. One is that there is a lot of information and we want to able to respectful of your time today. And sometimes when a lot of questions are asked throughout the webinar, that can create an obstacle for getting through all the information. Secondly, there is a chance that we won't be able to answer everybody's question today. If that is the case, if you have typed them in, we will still have each question, and when the webinar is over, we'll send out the follow-up email and we will have recording of the webinars also sent out to you. We will be able to send the list of questions and then answer so that all of your questions are answered properly. Now, let's go over today's agenda. So today's agenda at the webinar is first we will go over the quickly overview about what is chronic care management. Then we will go over the Medicare requirements to do the chronic care management. Then we'll go over the how you can do it in-house or you can also take our help in terms of doing the chronic care management. And the fourth step is we will go over that what can be the best potential step to go over the chronic care management. Feel free to ask any questions in the questions box. We have Melvin with us. He will be answering all your questions. So now, first, let's start with what is chronic care management. So let's get started by looking at the definition of chronic care management. From 2015, Medicare pays separately under the Medicare physician fee schedule for non-face-to-face care coordination service. And chronic care management service can be provided by, of course, by physician, or it can also be provided by non-physician practitioner, physician assistant, nurse practitioner, clinical nurse specialist, certified nurse midwives, or even the clinic staff under the supervision of any of the above. Now, the chronic conditions. So if the patient has a multiple two or more chronic condition, which is expected to last at least 12 months or until the death of the patient, we can provide those patients with the chronic care management service. Only one practitioner can bill chronic care management per service period per month. For one patient, one practitioner can bill chronic care management. So if a primary care doctor is billing the chronic care management for that particular patient, then specialist cannot give that patient a chronic care management service. So one patient, one doctor for one patient. Now, what is the goal behind providing those service? So the goal of Medicare is to seek the improve care of chronic condition by increasing the frequency of patient provider interaction by to drive the behavioral and lifestyle changes which would result in the decrease of either the emergency visit or the hospitalization of the patient. That's the main goal behind the chronic care management service. Now, what you're looking on the slide is like what is the reimbursement for the chronic care management. So the reimbursement for the chronic care management is anywhere between $42 to $142, and the average reimbursement per qualified patient per month is $42, but it can also reach up to $142 for the complex patients. Now, let me show you some of the statistics about the chronic disease statistics over here. So as you are seeing on the slide, over 133 million American suffers from at least one chronic condition. And chronic disease is responsible for 7 out of 10 deaths equals to 1.7 million American every year. Chronic disease accounts for 81% of hospital admissions and 91% of all prescription filled. Additionally, I didn't put it on the slide, but the chronic disease also counts for 76% of all physician visits, which means each of you here today probably have quite a number of patients who would qualify for chronic care management service. So each of you today or your clients, uh, either your practice or the clients that you guys are working with has definitely have uh, quite a number of patients that they can provide the chronic care management service. Now, let's quickly discuss the patient eligibility that we discussed earlier as well. But over here, in terms of patient eligibility, patient with the multiple condition, two or more chronic conditions, right? Either the chronic condition is there for a 12 months or until the death, those are the patients eligible. Here is the list of some of the chronic condition. Here are some of the examples, but there is an actual list available on a CMS website. And if you would like to have the list, please write your email address and we'll go ahead and send you the list, complete list of the chronic conditions. So like for an example, patient had arthritis, asthma, cancer, cardiovascular diseases, depression, diabetes, hypertension, chronic kidney disorders, HIV, AIDS, any of those diseases, or there is a, this is just an example. There is a list of chronic diseases which patient can have, and this way, this is just some of the examples. Now the conditions are being added as CMS has changed on the definition of chronic conditions. So those are some examples, but we have the complete list available. Okay, so this is the patient eligibility. Now let's go to the practitioner eligibility. Physicians and the following non-physician practitioners. So of course you can bill it under the physician, but you can also bill the chronic care management under certified nurse midwives. You can also bill it under nurse specialist. You can bill under the NPs, physician assistant, but to take a note that only one practitioner will be paid for chronic care management for a given month. So that's where to have patients sign up the consent form is very important, and we'll discuss it in a later part, right? So now the good thing is, let's say if you want to do the chronic care management service by yourself, you can have one of your certified medical assistant or one of your nurse can also provide the chronic care management service, 20 minutes phone call encounter, and this will be done under the general supervision. It is not under the direct supervision vision of the physician. It will be done under the general supervision of the physician. So this way you can bill for that particular practitioner. Now there are some of the statistics I would like to, couple of statistics I would like to show you. So if you will look at the CDC study of 31 million Medicare beneficiaries today in the United States, and they link it with 15 chronic conditions, and they found out that 2/3 has two or more chronic condition. That means almost 20 million Medicare beneficiaries have two or more chronic conditions. And MGMA, one of the report from MGMA, Medical Group Management Association, according to their report, there are 500 eligible Medicare patients per PCP. So every PCP has at least 500 eligible Medicare patients that they can provide this particular service. So you can see that there is a significant need of this particular service right now in the market, and we can help you provide this service, or you can also do it by yourself just by knowing the rules and regulation. Uh, so again, look at the patient's eligibility versus the provider eligibility, and this is, we will go a little bit in technical details over here. So patient has to have two or more chronic condition, or they can have if the patient has a serious health risk or two or more chronic condition, we will be providing them the CCM service. You make sure that that patient signed a consent form. And if you guys want a sample consent form, please write your email address in the chat box, and we will go ahead and send you the sample consent form for a chronic care management patients. Now, who will pay? Ultimately, the insurance, Medicare insurance will be paying. But if, let's say, Medicare is paying a certain amount and there are $8 to $10 left, either that can go to the patient secondary insurance. So if any patient has a primary and secondary insurance, patient is paying no copay. But in the other case, patient may pay up to, like, let's say $5 to $8 copay per month. You know, now the provider availability, like, what do you need to make sure that chronic care management service are substantial and you can give the chronic care management service? So you need to have a certified EHR technology. So you can be using one of the certified EHR technology which has a chronic care management services available. And then you need to have 24/7 access to the care management service. So patient needs to have a phone number that they can call 24/7 in terms of speaking with some operator to provide this particular service. Now 20 minutes per patient per month. So you need to we need to make sure that either one of the nurse or one of the certified medical assistant is talking with the patient 20 minutes per patient per month, and that person should create a detailed comprehensive care plan for that particular patient. Now the document the time spent. So we will go ahead and document the time spent, and we will show you that how this time spent can automatically be documented in our system. We will also show you the care plan, example of what is required in terms of care plan. So patient needs to have access to this particular care plan 24/7, and we need to create proper monthly reports, and we need to share the care plan if needed with some other specialist or some other clinic. Now, what are the benefits for a doctor to CCM benefits for providers or the practice? What are the benefits? Why should we do a CCM benefit? So first is, of course, an additional revenue. And we'll show you this chronic care management calculator where you can see the additional revenue, how much an additional revenue can be. The second benefit is increase in office encounters. So the chronic care management services can also help you increase the in-office encounters. And let's say you look into your database. There are 1,000 patients available potentially who can be provide the chronic care management service, and some of those patients did not visit your practice for last 1 year. Then by providing this chronic care management service, if they are interested, they can come back, and it will also help you increase the in-office encounter revenue. It will help you improve the quality measure, and it will also help you improve the HEDI score. It will reduce the burden of managing the Medicare patients. It will improve the workflow. It will have more patient satisfaction, and it will also help you improve your MACRA and MIPS scoreboard as well. Now, what are the benefits for the patient? Of course, the improved quality of life, 24/7 access to the care management, reinforcement of the health behavior provided by needed support, proper patient literacy, additional health coaching, they have somebody to speak with, and decrease ER visits, hospitalization, and unnecessary procedures. So this will help patient decrease the ER visit, hospitalization, and unnecessary procedures. Now the CPT codes for chronic care management. So let's say this, if we start providing the chronic care management service, or if you start providing the chronic care management service to your patient, the CPT code that you will be billing is 99490, which is for non-complex chronic care management service, and which is a 20 minutes encounter per patient per month, and where you can get paid anywhere between $42 to $48 based on the different insurances. But let's say if we are dealing with a patient who has a complex chronic care management and we give them service for 60 minutes, at that time we are billing them $94 per patient per month. And apart from the 60 minutes, each additional 30 minutes, you are billing that patient for $47 per patient per month. Every additional 30 minutes, $47 per patient per month. So let's say if you provide the service for 90 minutes, you can get paid up to $142, as we discussed, for a complex patients. Now, there is also one CPT code that you can bill for your new patients as well as your existing patients. So this CPT code is G0506. So this CPT code G0506. So let's say for an example, there is a new patient coming to your practice and you educate that patient about the chronic care management service. At that time, on top of your office encounter, you will also able to build this G0506 service. Or let's say if we are marketing this chronic care management service on behalf of your practice, and if any patient will come back and see you, same thing, on top of your office visit, you will able to build this G0506, and you will get paid additional $65 for that particular patient, just to explain patient about the chronic care management, and they sign up. Now, chronic care management calculator. So on DrCatalyst website, we have the calculator available. If you will look at the website link at the bottom, it's DrCatalyst, drcatalyst.com/CCM. You will see a chronic care management calculator. So let me go ahead and explain you about this chronic care management calculator. So annual number of unique patient. So let's say if a medium sized practice is seeing annual number of unique patients, which is 3,000, right? So if in that database there are 3,000 patients available, what a standard percentage of patients, Medicare patient, if let's say 24% of patients are Medicare patient, and the annual number of unique Medicare patients will be 720. Now, out of that, if you have 75% of patient who has a two or more chronic conditions, and we can help you generate that report out of your database. So Dr. Catalyst team can go to your database and generate that report for you, that how many of those patients have two or more chronic conditions who are Medicare patients. Now, annual number of patients, unique patients, let's say 540. And out of that, even if we will able to let's say get the consent form for around 85% of the patient, if we start working with them, and then you come up with a number around 450 patients, we providing the chronic care management service. So if we are providing the chronic care management service for those 450 patient, and average reimbursement is $43, then this is the gross increase in terms of annual gross revenue by providing this chronic care management service. So your practice can make additional $236,000 by providing this chronic care management service, we if ultimately you guys start doing the right setup and start providing this chronic care management service. Anybody is interested in more talk, yeah, anybody wants us to do some kind of analysis or help them generate a report, please write your email address in the chat box, and we can, our Melvin is taking notes, so he will reach out to you as well. Feel free to write any questions you guys have in the chat box, because we have Melvin available, he will answer all your questions. Now let me go ahead and uh, Okay, so let me go ahead and explain you why Dr. Catalyst. How can Dr. Catalyst help in terms of your practice in doing the chronic care management? So at Dr. Catalyst, we act as an extension of your practice, of your team, and our chronic care management program fills the gap between your office visit with one-on-one personalized better patient care visit. So now you can provide, ultimately it will help you provide more efficient collaborative care if you are using Dr. Catalyst services, and we will help you collect that extra revenue by helping you from starting to finish, and then you guys can just um, enjoy the revenue part. So we can help you towards the chronic care management service. So what is the ideal chronic care management process? So this is the ideal process that we are going to share with you, and either you guys can do it in your practice in house, or we can help you do that. But first you need to identify the patient. So whoever wants to identify the patients, we can help you run the queries, and we can help you identify the patients out of your database. Or you need to identify that how many Medicare patients which are there who has two or more chronic conditions. Then you need to designate a person who will be ultimately calling those patients, right? Helping them basically helping them identify what is chronic care management. That person will able to schedule a patient appointment, and once the appointment is being scheduled, either we can your doctor can inform the patient about the more about the chronic care management and take the consent form, or we can assign some of the uh, telephone calls, ultimately phone operators who can call your patient and who can also help you get the consent form for the chronic care management, because patient can also provide a verbal consent over the phone, and when they come to the practice they can sign the consent form, or patient can also sign this consent form on the patient portal. Or if you guys are using secure email, then you can also email this particular consent form to the patient, or you can mail this consent form to the patient, and patient can also sign. Once the consent form is being signed, then you need to go ahead and create the comprehensive care plan. So what we need to do, either a certified medical assistant or nurses needs to call those patients, right? And they need to spend 20 minutes with those patients, and they need to document a comprehensive care plan about the that particular patient's condition. Every patient will have a unique comprehensive care plan needs to be created, right? And then provide the patient with the electronic copy or the written copy. So you can even, next time patient come to your practice, you can even print it and give it to the patient, or you can upload it on a patient portal or send it via email, that to the copy of the comprehensive care plan. This way patient will have that comprehensive care plan 24/7 available with them. Also, you need to go ahead and document the time spent, that amount of time is being spent in the chronic care management. And you can also go ahead and do the billing and payment, or we can help you do the billing and payment for this chronic care management. Now, what are the what we need in the comprehensive care plan? What Medicare requires in terms of this comprehensive care plan? So Dr. Catalyst team can establish, implement, revise, and help you even set up one-time comprehensive care plan, which is electronic summary of following. So this particular comprehensive care plan, it's consist of like a problem list. So you need to have problem list over there. Our nurses can work with your patient in terms of problem list. What is expected outcome and prognosis? What is measurable treatment goals? What are the symptoms management? We work with your patients in terms of plan intervention. So those are the components of chronic comprehensive care plan. Then we work with your patient in terms of medication management and reconciliation. Under the chronic care management, you need to provide community and social service disorder, schedule periodic review and revision of the care plan, coordination of service and specialties, specialist outside the practice. So if we have to coordinate other services or other specialists outside of your practice, we can go ahead and do that. So those are the components of comprehensive care plan which are needed. Now, in terms of, let's say you decide to, you want to work with DrCatalyst and you want DrCatalyst to help you do this chronic care management. Our solution is end-to-end solution. We can help you from, we can do your hand holding starting from providing the services, starting from identifying the patient, to create the consent form, to build your database, to do the complete setup of chronic care management, and to go ahead and provide the services. We have nurses and certified medical assistant, team of nurses and certified medical assistants who can go ahead and provide your patients with the service of chronic care management. We can also do the billing, and we can also do the collection. We can do a complete work of chronic care management with you. So if, let's say, we decide to do a partnership together, so in the week one, we go ahead and evaluate your EMR system. We go ahead and work on, like, okay, what DrCatalyst in terms of chronic care management, what is needed to do the setup, and we draft the implementation plan, and we go ahead and draft the agreement. In the week two, we can go ahead and review the complete workflow. We can go ahead and review the, basically we can train our remote nurse on your EMR, and we can work on according to your workflow. We can work with the doctor to develop the workflow. In the week three, we can start contacting the eligible patient, start getting the patient consent form, and start creating the care plans for you. And in week four, we will go ahead and do the billing and collection, and we will start setting up the next month's follow-up. And we go ahead and submit you the revenue report every month, and we decide the particular protocol of doing the monthly and weekly meetings with you, so that doctor can review the those care plans. uh, During our weekly meeting or monthly meeting, we just ask you to do monthly or weekly, like 1 hour meeting with you guys, and we go ahead and show this care plans to the doctor, have him sign, and we go ahead and discuss the revenue report of that month. Now, for DrCatalyst, we are using intelligent medical software uh, to manage this chronic care management. And intelligent medical software, IMS, has already has the care management tracking module. So I will go ahead and explain you that how this care management tracking module works. If you want to look at the live demo, please request us for a live demo, and we can even go ahead and show you this, how this chronic care management module works, or we can even provide you the detailed training of the setups and everything. So this chronic care management module over here, if you will see that, let me go ahead and explain you some of the modules. That by using this module, we can track any number of patients on this particular screen. So we can track any number of patients who are available on these particular screens once they are eligible and once they sign up the consent form. So for this particular doctor, there are 164 patients who has signed up the consent form. So you see the numbers right there. Then we introduction of the program, receiving the consent form. So you will see the complete patient information over here, whether the patient has a patient portal or not, you see right there. You will see the which program patient is registered, whether the program is a chronic care management, or whether the program is a non-complex chronic care management or the complex chronic care management. You will see the program name over here. You can access patient's chart view right here. You will see that what date the patient has been enrolled, and over here this particular small icon is the patient's consent form. Then you will go ahead and see the program status, whether those patient is active or patient denied the service, whether the patient is active, patient is on hold, patient denied the service, how many chronic ICDs that patient has, what is the time spent by us, like how much time did we spend on that particular patient. This system will record for you automatically, and how much time is duration is left for that patient. So system will tell you about that, and system will also tell you the risk measurement of the patient, whether is this particular patient in a serious risk, or there is a no risk, moderate risk, or high risk. So system will alert you on that part. And who is working with patient right now, is this, let's say you can have your nurse name over there, or you can have your certified medical assistant name right there, and what is patient's insurance. So you will see everything right on the one screen. Let's say if it's a low risk patient, it will be in green. Medium risk, it will be in a light green. Then medium, high risk, and high risk, and not defined yet, right? We have a lot of filters available right here, so you can go ahead and look for the filter. We have done the filter for 2018 June, how many patients are being registered. The beauty about this module is every month, so let's say one time we get, the first time we need to work hard in terms of generating the patient database, and let's say we come up with 200 patients who are active and actively working on this chronic care management module, and we did a first visit with those 200 patients. The next month automatically module will reset. Module will also do the help you set up the follow-up with for those patients, and then we can see that how many patients are done every month. So this is a complete automation for your chronic care management service. Now, in terms of tracking all the details, so in terms of tracking all the details, under the chart view, there is something called care management. And in this care management, we can track all the different tasks that we have done with the patient. So we spoke with the caregiver, then we work on the care plan and created the care plan for the patient. We work on the voicemail, we left couple of voicemail, and then we educate the patient about chronic care management. We work with the patient for medication, we work with the patient for lab. It will track the complete task with the time period over here, right here, and you will see that under the chart view care management module. Now the care management module timer, so this is the timer which we were talking about. So over here you can click on start time when you start the timer, and when you stop time you can do start and stop of the timer, and you will see that how much time we spend with the patient and what is the task type. So let's say we work on the creating the care plan, we work on call assessment, we call the patient for follow-up instruction, we are calling for patients test results, we are calling for managing referrals, right, medication management, any of the tasks that we are doing, because every single task counts over here towards the time. So any of the tasks that we are doing, this timer will run in the back end, and it will automatically document the time. And this way, while we are even working on the task, it will automatically document the time right here. Okay, so in terms of chronic care management, if we work together with DrCatalyst, we have uh, we have two kind of packages, and DrCatalyst can help you in terms of two different kind of packages for chronic care management. So the first package that we have is, let's say you decide to do chronic care management by yourself, and you want us to help you set up your particular database, you know, then the package is $599 one-time fee, where we will go ahead and work with you on IMS chronic care management module and setup. We will help you do the complete setup. We will have our consulting available, right? And we will go ahead and set up your templates, we'll go ahead and set up your database, we'll go ahead and help you even figure out how many patients are there, how can you load that, and we will go ahead and do the couple of test runs for you in terms of you can determine that, okay, this is how the chronic care management work, and we'll work with you on the workflow for a couple of test patients. Or let's say if you want us to work on everything, starting from we assign our dedicated nurses and certified medical assistants, we help you set up the module, we help you sign up the patient consent form, we provide you dedicated care manager 24/7 availability, right? We help you towards the care plan creation, monthly revision, we help you toward disease band protocols, complete billing cycle management, improve the patient's appointments. If you want our help in all those portal, even the online portal management, monthly performance report, if you want our help, then this is our charge. Like DrCatalyst will just charge you for first 249 patients. We charge you $20 per patient per month, where you will get around about $43 to $48 per patient per month. Then if we the second 200, and so let's say as soon as your patients will increase to 249 plus, so starting from 250 patients up to 499 patients, we charge you only $19. So as we help you increase your patient database, and then we charge you less. And if you will able to help us register 500 patients, then we only charge $18 per patient per month, where we do the complete work for you, starting from getting the patient consent form, educating the patient for chronic care management, doing their care management, creating the care plan, etc., etc. So we can help you starting uh, from the starting to end for this chronic care management, and those are our pricing, right? So please get a personal consultant right now who can evaluate the chronic care management for your practice. And you can click on at www.drcatalyst.com/chronic care management, and we can help you do the personal consultation. Right. So now we'll have next 15 minutes and 10 minutes towards the question answers. Right. So let me go ahead and start answering the questions. Anyone has any questions, please write the questions, um, so that we can go ahead. And so first of all, one question we have is, uh, are the tasks drop down, are the open fields? Yes, the we have a question from Chaz that yes, the task drop down are the open fields over there. So basically, let me go ahead and go to that particular screenshot about the task. And then the second question we have is define the risk in the system. And then the third questions we have is how do you track the success of the main goal in chronic care management over the time? Okay, so those are the very good questions. Jazz, let me go ahead and answer your questions, right? Nancy wants the consent form. So we will send the consent form to Nancy. So the first question that we have over here is, uh, let me go to the our module, chronic care management module that we designed. So over here, in terms of tasks drop down, so those tasks you in within the system, we can configure those tasks. So we have the setup available. This is the open fields, and you can easily create the drop down, that care plan creation, on call assessment. So those are the open fields. You can easily do the setup, and you can add as many tasks as you want over here, right? So that's about the task. Now the risk management, as I explained you, like if it's based on the certified medical assistant and remote nurse who will work on this particular risk management, and they will discuss with the doctor, and they will go ahead and decide if it's a low risk, medium risk, high risk. So that's something I have Sandy over here. She is my team member, and let me have Sandy answer that question about how they define the risk management. So Sandy, you there?
Yes.
Sandy,
Hello.
can you explain everybody about how we define the risk?
Yes, the risk we find it when we're speaking to the patient and we note it. I kind of ask all the questions that are needed to ask, and I if they are bed bound or wheelchair bound, then I make it a medium risk because they're able to still talk and still move around. And if they are like bed bound, then that's a high risk.
Okay, got it. hmm Anything else you want to add towards the risk management?
Um, a lot of the patients, they even though they have pain, they still want to do everything on their own. A lot of them say that they can't just sit around, and through pain, they still want to be at a low risk. So I determine either they're on low, medium, or high risk just by the way they answer the questions.
Got it, Sandy. Thank you. Also, Sandy,
Hmm.
can you while you speak with the patient,
Hmm.
can you explain little bit about the flow in terms of like what kind of questions do you ask, etc. Can you speak a little bit about that part?
Yes, I ask them first of all how they are and how their pain level is and what are they taking for the pain, and also what is their current weight or blood pressure, and if there's any changes in medication or if they have been hospitalized. I mean, there's sometimes they just go on and tell you everything.
Got it. Hmm. Good, good. And how do we coordinate with the clinic staff? So if there are anything, can you explain a little bit about that? Like if patient needs an appointment and how we coordinate, so this way
Yes.
our audience will have some idea, how we immediately coordinate.
Yes. I after I speak to them, I call their doctor, or I call doctor's office and ask if they could get an appointment for them. Sometimes they get the appointments there, schedule it, and tell me, and then I call the patient back and give them the date and time that their appointment is set up. Sometimes the doctor's office will tell me, okay, Sandy, I'll call them for you.
Hmm.
So yeah, but mostly I do it because the patient is waiting for me to call, and I don't like keeping them waiting.
Got it. Perfect. Sounds good. Uh, Thank you, Sandy.
You're welcome.
Team, please feel free. Anyone has any questions, feel free to ask the questions. Please write the questions in the questions box. Uh, or if you guys need some detailed training, please write it down. We will get back. We can get back to you, and we can answer all your questions, or we can even provide you the detailed training related to chronic care management. Hmm, good. So thank you so much for joining the webinar today. Uh, this is all, and we look forward to seeing you on the next webinar for different topics. Thank you. Have a great day.